exciting to be here today with you and to think about the presentation that we're going to be having. Let me say something about Herta first before I turn the floor over to her. So she is here, she's a PhD candidate at the University of São Paulo, and she is here as a visiting scholar with the Institute. And this is a long-standing relationship we've had with the University of São Paulo, where we've worked together for about 25 years. And so it was very exciting when I was contacted and told that she was interested in coming to work with us and to be sitting here. And it's been a real pleasure to have her here with us. And so one of the things that I think we're really excited about is to learn about self-testing in Brazil, and to understand her works. And I want to say ahead of time, to make it easier, hopefully, which is that she isn't finished with her work. Right? She's in her analysis, right? So what she's presenting to us is where the work is now, not necessarily full conclusions at this point,
true.
Right? And I'm hoping for kind of a lively discussion, and I'm hoping that we learn a lot. And would you all join me, please, in welcoming her?
Thank you. So thank you, Sophia, for receiving me and for the words as well. So my name is Herta, and I'm from University of São Paulo. And today I will present my thesis. As Sophia said, it's not finished. We are still developing the work. So the title is Oral HIV Self-Testing for Men Who Have Sex with Men in Brazil. So during my presentation, I will do like a brief introduction and then show you the objectives of my thesis, methodology, and partial results as well. So for everyone know about HIV/AIDS in Brazil, according to the Brazilian Minister of Health in the middle of last year, we had almost 900 people living with HIV there. And by that time as well, almost 400,000 people died because of AIDS or something related to it. So in this graphic, we can see the prevalence of HIV by groups. We can see like the first one is general population from 15 to 49 years old, and then men, women, pregnant women, people from army, and finally MSM, we are focused on. We can see that MSM, especially the last one was a study did in Brazil in 10 cities there, with MSM from 18 years or more. And we see that the prevalence in the last part, we can see the prevalence was 18.4% in MSM. So I'm showing this graphic just to let you know why we chose to do the self-testing just with MSM in the project right now, because it's new in Brazil, just arrived there like 2 years ago. Also, currently in Brazil, the main strategy used to prevent HIV infection is the combined prevention, which is primarily people can choose which tools, or just one or more than one, that is better for them at the time of life, and use to prevent HIV. So some of them, 5 of them, that is really important for the project itself is HIV testing, ERT, pre-exposure prophylaxis, post-exposure prophylaxis, and condoms and lubricant gel. For just let you know if you don't, in Brazil, our healthcare system, called SUS, is for free. So everyone who lives there can go and have access to testing and treatment and condoms, everything for free. So by 2015, the UNAIDS came out with a strategy called 90-90-90, and which means that by 2020, people like countries should have 90% of people living with HIV knowing their series status, and 90% of them should be at treatment, and 90% of people under treatment should be with viral load like almost zero. This way they can like pass the infection, pass the virus to other people. So in 2018 in Brazil, we can see how was it. 45% of people knew that, like 85% of people with HIV knew that they were positive, and 77% of them were in treatment, and 94% of people in treatment were with zero viral load. So we can see as well, like the numbers, like just like for the whole total as well. So our current challenge are late diagnosis. So people are getting tested late, and while the time they knew that they have HIV, their CD4 cells were less than 200. Also, uptake and retention in care, people don't go to health centers, or they don't continue to go, even though the treatment is for free and they have physician for free as well. Also, they have some problem taking the treatment the way they should do it, and co-infection, especially TB and HPV, and stigma and discrimination, not just because HIV, but also because they are gay, that are the population we are studying here. We can see in this graphic the number of people, like new infections in 2019. Oh, the data is from 2018, sorry. 27% of them, of people new infected, were with less than 200 CD4 cells at the time. So, and you can see that since 2009 till 2018, like they didn't change it like so much. They still like almost the same, like 30, 31 in 2010, but almost the same. Even though the past government of Brazil was trying to not now. Sorry. Like access to health services and trying to train people and give more tools to them. So what we can think that will help Brazil to improve and decrease the HIV infection? Scaling up of HIV testing, which is the main goal that we are trying here in this project. Scaling up early ERT, the test and treatment strategy. So when the person discovers that they have HIV, start the treatment, not right that same day, but earlier. Action to enhance linkage and retention. They are having a lot of NGOs there doing this, especially one I think is American, is IIGH. They are doing there in São Paulo some project with linkage and retention. Use of combining HIV prevention technology with behavior, structure, and biomedical approaches as well. And integration of healthcare service. This part I think is we are really struggling on it. So what we are trying to do in my thesis, understand the perceptions and meanings of oral fluid HIV self-test among men who have sex with men, and learn the test users' perceptions of their testing experience. So it's a qualitative study. I will explain you that they have, we had a lot of, like a huge project, and my project, my thesis is just like the qualitative part of it. Also, we are trying to understand individual, social, and programmatic dimensions of vulnerability of MSM who performed the self-test, and identify limits to and potential for carry out the self-test through the lens of human rights. So for that analysis, you are going to use the vulnerability framework as a guide. So we are going to look at the individual, social, and programmatic vulnerability. In the individual one is associated with emotional, biological, and cognitive aspects of the person, is individual. The social is related to access to goods, services, being influenced by socioeconomic and cultural factors. And finally, programmatic vulnerability says that in given situation, social circumstances, institutions such as health, education, culture, and social welfare reproduce the societal elements of vulnerability. Also, we are going to use the human rights framework as well. That is the reason I'm here. I'm trying to learn from Sophia and to use it at my thesis. Until now, I'm still working on it, and I just like put here like 5 rights that we are thinking about to use it as a guide and help with the analysis. The first one is right to health, including the triple A and Q, which is availability, accessibility, acceptability, and quality. The right to informed decision making, the right to equality and non-discrimination, the right to information, and the right to privacy and confidentiality. So as I said, my thesis is is apart from a huge project called The Time Is Now, translated to English. The project was done in São Paulo, the city of São Paulo, between April and December of 2018. So the main goal, the main aim of them was to evaluate the implementation and distribution of oral HIV self-test for men who have sex with men with 18 years old and more. So what they did, people just entering the website and filling out a form, answering some questions. They never said their names or cell phones or websites or email, nothing. And after, when they finish, they can choose where the place that they could pick up the test. And they went there and they give just a number and receive the test. And they receive a box with the test inside and some papers helping them to know how to use it and how to perform the self-testing. And also asking them to put the results after they finish it. At the website, they already they have as well a video helping them how and telling them how to use it, the self-test. So if the result was positive, they should go there to the website and they ask them to go to 3 health centers. In São Paulo, we have 100 or more health centers just for HIV, but we chose to select just 3 for it be easier for us. And for them as well, because the 3 that you chose was the most popular ones, the biggest one. And if the result was negative, they ended participation and was done. So from now on, I will talk about my thesis. So just 27 people, the positive, put the result there on the website. And I went through the 3 health centers looking for them, but I just was able to find 12 of them. From these 12, 3 of them moved to other cities, so I wasn't able to go there and talk to them. And 2 did not go to the appointments because I went to the health centers and saw when they have appointment with the physician, and I was looking waiting for them there. Then when they arrived, I asked them if they could do the interview with me. And while I was doing, I didn't find these 2 they at the health center, they have some people who call them and say, why are not coming and blah, blah, blah. But then I was coming to US and I wasn't able to talk to them. So in the end, I did 6 interviews with the positive one. It's a big concern that 15 of them was not found. So we don't know if they didn't go to other places, other health centers, not the 3 that I was talking about, or if they didn't go to health centers at all. So it's a really huge concern that we have about this part of the project. So we also distributed HIV self-testing during campaigns at street, and I was there. And when someone asked for the self-testing, we gave it to them. They need to fill out the form and etc. And then we gave it to them. And I asked them if they could give me their numbers, and then I can send them a message and ask them if they could do the interviews. So 321 people gave me their numbers, and I sent a message for everyone asking if they could do the interview, but just 12 of them really went to do the interview. Some of them didn't answer, and some of them answered but said that they couldn't go, or because they don't want to, or because it was during hours, during business days, or something like that. And all the 12 were negative. It wasn't my intention, but just appears, just occurs. So at the end, we did 18 interviews, which is like for a qualitative study is quite okay. I think so. I hope so. For data collection, individuals who agreed to participate in the study were asked to choose in the location of the interview and the day and time as well. Usually we did it at health centers because it was like the safest way for me. And actually sometimes I went like to health centers and stayed there because some of them open till maybe 9 p.m. at night, and I was like ask them to go, and some of them went. If the person didn't have money to pay like the bus or subway, I gave them money to pay it. Data were collected through a semi-structured interview, and the interview were recorded, and right after I did the transcription. For data collection as well, the qualitative data are being analyzed, like right now, according to the discourse analysis technique. And this technique was proposed by Fiorin and adapted by Carr and Bertolozzi, using the vulnerability and human rights frameworks as guidelines. Also, the participants' data will be analyzed separately and grouped based on their similarity. For example, we have like 18 participants, and we'll see later if they have some similarity. For example, if they never did one HIV testing before, and then the first one was self-testing, then we can group people who did it. Or maybe people who told me that they had some experience of discrimination and some people don't, and then we can separate it like, and then after I separate them in groups, I will put them together and compare the groups, if they have some difference between the groups. And the project was submitted to the Institutional Research Ethics Committee and obtained approval, and there is the number. So the partial results, I brought here like this table just for let you know like who are these people and something about them. So most of them were aged between 20 to 25 years old, but we can see like the oldest one had just like 42 years old. So mainly we found people like younger. The education, it was like a surprise for us. Like 15 of them were higher educated, so they went to college. 11 of them told me that they were homosexual, and 6 that they were bisexual. 12 answered me that their sexual orientation was new, that people like friends and family knew that they were gay. And 6 told me that they didn't told them. But like from the 12, some of them like, yeah, people knows, but then like, oh, my grandma doesn't know, because, so not like was openly and for everyone. So, and I asked them about the experience of stigma and discrimination. 16 told me that they had experienced some kind of stigma or discrimination, and just 2 answered no. And 4 of them never did a HIV testing before. The first one was self-testing. So for the qualitative results, I just like brought some quotes from them because I can't like put everything here. And I just categorize, like I put some categories, but it's not the one that I will use in my thesis, just like to help you understand. So the first one, I called it Prejudice. So what he said, at school, in the church I was going to, I was bullied. I never have been physically assaulted, but my own family members, they said, if you are like this, you are not my relative. So institutions such as church, schools and family that we can think that should like protect them are doing the opposite. And just for you know, religions in Brazil is really important, really, really important. About health centers, the ones that already did HIV testing, I asked them how was it and if they liked it or not. Some of the answer was like similar to this one. I avoid the hospital and UBS. UBS is our basic healthcare unit, because sometimes I come across prejudice and discrimination at the health unit itself. So like this quote is very similar to other ones. So you can think that even if you are like trying to train and prepare professional, they aren't. And actually, some of them told me that they don't feel safe getting a positive result at UBS, at health centers. Also, I saw that they have fear of HIV, especially not because the disease, but because they are gay. So one of them said, I have always gotten tested for HIV because I'm gay. I always do at least every 4 months or every 6 months. Every time you go to do a test, because of the stigma of the disease, even though I'm fully aware of what it is, the epidemic, the story of the epidemic, there are always butterflies in my stomach. Even though I'm aware, I'm always nervous. But now I know this is part of it. And I don't know if I can get away from it. Even knowing the way I live my sexuality, the chances are really low. But I still always get goosebumps. So even if the person didn't have sex without condoms, they go to the health center and do the HIV testing. And even though they didn't have sex without condom, they are afraid to receive a positive result. About the self-testing itself, I didn't have like agreement about it. Some people love it and some people think they're the same than the other ones. So one answer is, for me, the main advantage is the convenience. You can do at home, the time you can, and when you feel psychologically prepared for it. So for me, the good part was that I don't have to go to UBS just to do this. I think that is the main advantage. But the other one said, I thought it was going to be almost one anthropological experience. But in the end, it was not. For me, it wasn't too much. So finally, I brought some opinions about self-testing for people who receive a positive result. The last one was for negative. So one of them told me that when you have a positive result, you are afraid you didn't eat correctly. Then you hope you didn't something wrong. And another one, in fact, I was a little sad, I cry a little. Then I come to take the final doubt, the second test. And because they are divided, if the result is positive, you have to go to the center to confirm it. So 2 things. The first one, I think almost like every positive told me that when they did the self-testing and saw that was positive, they hoped or they thought that they did something wrong. And they just like went to the health center to have the second test and know for sure if they have HIV or not. And another thing that is like, you can see, the second one told us that they went to the health center to get the second test because they knew. So we can see here that the right to information, like in some way, is being protected. So this is the kit that we are distribution with condom inside as well, and this is my mail if you have some questions. Thank you.
So the floor is open for questions from folks.
Mm-hmm.
So with these self-tests, where did they get the results? Were they able to do that anonymously, or did they have to go to the UBS to get the results?
No, they just like took the self-test, and we asked them to put in the website, but they could do it or they couldn't. Yeah, it's like almost all of them didn't. So, but like they did it by themselves, and like first we didn't know if they did like at home or if someone. I guess.
Were they provided like any type of support services that they could access?
Yeah, they have like, we had a hotline, like a number, cell phone number that they could like call them like 24 hours per day. And also in the website, they put the address of the institution and health care centers that they could go if they want. And at the website, they have like the pre-counseling test there, like they have some like video talking about like HIV and how they will do it, the test, and after how to like use condoms and that stuff, like pre and post.
This one?
Yeah.
Of all those that tested positive and gave you guys their results, did they all get confirmed as positive as well, or was there anything?
Yeah, all of them. Mm-hmm.
That's kind of what my question was. Were there any false positives and that people got a positive, but then when they went to the center for the confirmation, it was negative? Any
Yeah,
issues like that?
like we had like maybe just 3 that put it on the website, but like I was working in a health center in São Paulo at that time, and I was working there, and just suddenly I just like hear some screaming, and I went like out to see what's happening, and then was like a man with his woman, like his wife, and he was saying that he did the self-testing and was positive, and the wife was saying, oh, he's gonna kill me and my kids and blah blah blah. And then we did the testing, like the HIV testing with him again, and was negative. But what happened? He did the self-testing because like he like cheated on her, and did like at his house, and went with her to the church, and then was there for more than 1 hour. And then when he came back, the result was positive, was like false positive. But yeah, and he didn't put there in the website, so I think that they maybe have more numbers about it.
I'm curious on what Herta is called in the first place and why you chose the NSN group.
Okay. Yeah, the idea was from my advisor. The self-testing just arrived in Brazil in 2018, the same year that they started the project. So that's the reason he chose to study it. And MSM because like for us in Brazil, like huge part of people with HIV are MSM. If you look like even vulnerable groups such as sex workers and drug users, the one group that is higher prevalence of HIV is MSM, and especially young people. So we are like happy to see that our, like for example, for my qualitative part, most of them was younger as well.
So I have questions.
Mm-hmm.
Okay. So a couple, I mean, just to follow up on that for a moment. So, so these are young men who identify as gay? Or is this a website that is only for gay men? Is this a website for anyone? Like how is it that people self-select into the website?
Yeah, they advertise like in Facebooks and Instagram social media, and then during the fill out of the form, they need to choose like, okay, did you have sex with men in the last, I don't know, 6 months? And if they answer no, they receive a message, okay, we can like go through this project, is not for you, and blah blah blah. So that was like the selection just for men who have sex with men. Like everyone could go to the website and try to like receive, but then they were like, okay, in the beginning we are having this project just for MSM, not for the entire population. But now HIV self-testing just like came out like in Brazil, I think last year, but it's not from oral fluid, it's from blood, and they are doing for the whole population.
Making it available.
Yeah.
Okay.
And it's not a project. The Ministry of Health like bought like 1 million testing.
And in terms of the follow-up that's needed in terms of post-test counseling,
Mm-hmm.
right, that's needed, which isn't just use a condom, but basically what does it mean to have an HIV test?
Mm-hmm.
That is all expected to be done, even though people test at home. It's assumed that they're going to get their post-test counseling in person, or how are they going to get the support that they need?
Mm-hmm. At the website, they have some support, like some counseling, some like, because like the website is not more like, they deleted. At the website, and I don't know why.
We know you deleted what?
The website,
Oh, okay.
yeah. At the website, they have some counseling, not just for positive, but for negative as well, and telling everyone like the health center that they could go, they should go if they want. And inside of the box, they have like a paper telling again like the counseling that maybe be like done personal, and giving the number of the hotline number if they want to call someone and ask for help.
Okay, but great, but that isn't really post-test counseling, right?
Mm-hmm.
Right, so that, I mean, that's all important steps. But the question is, so those are steps towards ideally somebody giving post-test counseling,
Mm-hmm.
right? Because a website can't give that kind of counseling.
Yeah. Usually when they pick up the HIV self-testing, like the box, the person who are giving to them was like health professionals, and they explain it and try to help them about it.
Other questions about it?
Is there a difference between the bone testing accuracy rate and the blood testing rate?
No, it's quite the same. The difference, like one is like with your mouth, and the other one with blood. During like the interview, some of them told me that they prefer to do the oral one, but other people told me that they don't feel that the oral one is safer than the blood, but it's almost the same.
What type of consent form of questions did you have, like, before you actually went to have these preparations?
Yeah, I asked them if they could give me their numbers, and when they said yes, we scheduled the appointment, and I have like the paper, like talking about everything about the study and asking if they want to enjoy the research or not. And they sign it, and it's in Brazil.
And that is submitted by the university?
But yeah, through the ethics committee from Brazil, from USP, University of São Paulo. Yeah.
So I'm really struck with the fact that the 15 that didn't come back,
Mm-hmm.
right? And so thinking about that, and thinking about the fact that there isn't post-test counseling,
Mm-hmm.
right? Thinking about, so it seems as though the 15 being lost tells a story that's very important,
Mm-hmm.
right? And so one of the questions I have is, I'm surprised that the Ministry of Health has then decided to make this widely available.
Me
when
too.
It sounds like there's problems. Yeah, could you talk a little bit about that?
Yeah, like I don't know what happened. We are like in the middle of the project, and then like one person from the Ministry of Health just bought like 1 million as HIV self-testing, and it wasn't even the same one that we were using. It was like the blood one, and you don't know what happened if they like should like waste their money, and then they chose to bought HIV self-testing. We don't know what happened.
But do you worry or do you not worry about the implication of that?
For
right?
sure.
For what it means for vulnerable populations. Because I'm thinking about the human rights and
Uh-huh.
vulnerability analysis of
Mhm.
this, and there seems to be something very important
Mm-hmm.
in the fact that you lost a lot of people.
Mm-hmm.
So a process that shows that there's a lot of vulnerability that's not being addressed in this approach,
Mm-hmm.
right? And then the ministry decides to go even further down that path.
Yeah.
So I don't know, have you all talked about that a little bit? Like what?
There's one question I think like I can ask Aloysio and then answer you, because he was the one who was talking with them.
Your supervisor, basically.
Yeah, sorry. He was talking with Adele Benzachini, the person like, who was like in honor of that. So yeah, but like I remember he was not happy at the time because we are in the middle of the project and they bought it, and the main point of doing this project was like to know what will happen and how you can implement, as a public health strategy to Brazil. And then he just like bought it and didn't wait for the results and our points. So
Right, so it's without the evidence to support that this is a
yeah,
strategy.
it was the main point. Yeah.
My question, in line with what Sophia was saying, and this issue with, the disappearance of the test and everything, is there some way that you can put some information out to people, that may have participated, some way to, I guess, provide some kind of support,
Mm-hmm.
some kind of information about...
If they went to apply.
Yeah, if they participated in this study, if they can be contacted and allowed to get support if needed,
Mhm.
or something to kind of like recoup that loss. I
Mhm.
mean, because consciously, that would bother me too.
Yeah.
Just to know these people who are like lost in the shuffle.
It was the problem, like at the time of the project, they have like a problem with people working in the reception of healthcare centers. So maybe that is the reason we don't have like, we don't know where these people went. So yeah, I think we can like know this, but like we need to go to every health center in São Paulo and see the name of people who like entered the new infections from the beginning of the project till the end and look for them. But the problem is we don't know their names, so.
Yeah, but maybe some kind of, what is it, like a community post or something that could go out, that if you've ever, I mean, like here in California, here we have messages like, if you ever had this type of surgery or if you've ever done this type of test, you know, call this number for information or whatever. Isn't there some kind of public service announcement or way that it could be advertised?
Can I follow up on that? I think you're talking not only about for the purpose of the study. I think you're
But for
talking
the
about
people.
For everyone,
For
okay.
the people. So I want to make sure, I agree.
Yeah,
with you.
no,
So it's
for
like-
the people, not the study, because the study looks like it just dropped the ball.
Yeah, they have some NGO just like working with MSM and transgender people in São Paulo, actually like in the whole country, but especially there they have a lot of NGOs and they go to places like, you know, like people like poor people go like some place like this and they go every weekend and also they go to parties like at night and then it's kind of like a support. It was like one of these NGO that I went with them like to give the self-test and ask them if they could give me their numbers.
But that might be a vehicle.
Yeah, some kind of public
Some
service
public
to
way.
find out if we can offer support to those people that were lost, that may have started but didn't finish.
Right.
Can I follow up on that? So let's say these people go to a place to get support. The people who are providing this support, how are they trained? Is anyone trained?
They are health professionals. And usually people who work in the NGOs works in the health centers at São Paulo as well. So usually are the same. But some of them, for example, they have like some transgender people working on it. And they, if they are not health professionals, they get trained in the health centers.
And they also know about self-testing.
Yeah. Mm-hmm.
So I have one more, and I'd like, if other people have issues, because we're all like talking to this. So you're interested in bringing a human rights analysis to this.
Mm-hmm.
So I'd love to hear how you're bringing human rights to the way that you're thinking about this.
Mm-hmm.
Like what does it tell you with the data that you have?
It's kind of like surprised me some stuff and other don't. And I think like because I didn't like go through like the whole analysis, but I did all the interviews, so I know like the main points there. So I think about that will really helpful because I can see like some human rights that we are thinking that we were protecting, we are not, for the opposite. And some that we think, okay, maybe this can be a problem, and for them, it's okay, do you know? So I'm still working on it. I need to talk to you like later. But since I'm here and doing the classes and reading material, I can see that I can see more human rights aspects in my analysis than vulnerability.
And do you think you'll be able to make recommendations out of that?
I think so, but I don't know if we could like get in these recommendations. Do you know if it would be easier for them to do it? Like for example, you know that people who do self-testing should go to health centers if they have the positive result. But how you can do it? How you will have sure that people are going? Do you know if it's like anonymous like we did? We can, because we can go like through this person and look for them if don't have their number, their name, nothing. So it'll be like hard for it, but yes.
What happens next with this project?
Like for me or the project? Okay, my life, I don't know. I'm just like trying to finish my PhD. And about the project, I need to talk to my advisor and see with him like if we can like have some appointment with people from the Ministry of Health and talk to them like what they thinking about and what data they have as well, because they are doing like they are giving people self-testing, and I think for the general population, not just for a MSM. So yeah.
I was going to just like touch on the anonymous aspect of
Mhm.
it. Like maybe you could have the health centers kind of just like have a check mark of like how were you recommended to the health center, what brought you in. Maybe one of those check marks could be your program, and then you could just collect that data from those health centers without getting identifiable information. And some ways it kind of like provide more evidence for the program or
Yes,
opposite maybe.
true. Actually, we were like doing something like this, but like some of them like they didn't told people. Like for example, one of them told me that they went to the health center and didn't say anything about the self-testing because he was like thinking about, okay, if I tell them that my result was positive, the result will be positive again because they knew that it's positive, you know? So they are trying to know the truth and they didn't say that they were doing the self-test before.
Thank you, everybody. Thank you.
Thank you.